Welcome to the 5% PT podcast. I'm your host, Dr. Corey Harris, physical therapist. I created this platform in order to give voice to those minority therapists in allied health careers. This episode is a brief introduction to myself and will be posted in conjunction with episode 2 with our first guest. Tonight, I have a good friend and consumer of physical therapy services in order to help conduct a brief interview of myself.
Dr. Harris, when people think about healthcare workers, they reference careers like doctors, nurses, even CNAs. As a health practitioner, tell us a little bit about when you first realized that you wanted to be a physical therapist and why you chose this career path.
So initially growing up, I thought I had a nurturing personality, and I've always wanted to do something in healthcare because I feel like I had a niche for taking care of people. And thinking about careers, I thought I wanted to go into sports medicine. In high school, taking I think it was an allied health career course. A teacher told me about physical therapy. I did a little research into it. I saw you can be more diverse, how diverse you can be in the field in terms of practice settings, and that you get to spend more quality time with your patients. So after researching that, I knew that's the route that I wanted to take in order to pursue becoming a physical therapist.
So what was your experience applying to and matriculating as a PT student? And kind of tell us some courses that you took in undergrad to prepare for graduate study in the field.
So prior to applying to physical therapy school, I did some research into the schools I wanted to apply to. I looked at their prerequisite courses and made sure I took those classes in order to be a good candidate when applying to those schools. Some of those classes included anatomy and physiology, some basic level science, chemistry and biology courses. I think I did like a biomechanics course as well. I ended up majoring in exercise science, which kind of prepared me pretty well in order to enter into a PT program. And I did a summer internship program at Ohio University for about 6 weeks, where they had minority students interested in physical therapy and becoming MDs come there for 6 weeks, kind of prepare them for what graduate level courses would be like.
Good deal. Tell us a little bit about, I know that as you came into the career, one of the things that you probably had to decide on is where you actually wanted to work. A lot of people are not, or do not know that PTs are placed in various medical settings. Can you kind of talk about those, separate settings of various agencies and institutions as well as where you've worked in the past?
All right. So kind of like a lot of therapists, I thought I wanted to go into outpatient orthopedics. But during school, you go on several internships, kind of introduce you to different settings. But during one of my internships, I was actually offered a job at one of the facilities. I was interned in Georgia, but the job opening was in Virginia. So I actually accepted that offer, was in Virginia for a couple of years in outpatient orthopedics. Thought I did pretty well there. I had applied for a promotion. The director contacted the owner. The owner was coming to town. We were supposed to sit down and have a conversation about the promotion. But once I actually got in front of the owner, he actually didn't know why I was there for that meeting. Kind of looking at that and then thinking about things that were going on in the clinic in terms of who was coming in as far as new therapists and what their relationship was like with current directors and other people in higher positions within their company. I kind of saw that promotion wasn't going to be coming my direction. So I talked to a good friend who lived in Houston, where I am now. She told me about a position open with the company she was with, was actually in home health. So a setting I hadn't worked in, but I was open to new things. Applied for the position, got the job, up and moved, had never visited. But actually home health is pretty cool though. To me, it's like bringing outpatient therapy to the patient's home. So they can't necessarily get themselves out of the house to get to a clinic or get to a facility. So we're going to them. You have to be very creative in what are you able to do with those patients. Now, in terms of practice settings, you have therapists that work in sporting arenas, those who work in pediatrics, geriatrics. We have those in private ownership with their own clinics, even mobile therapists as far as the home health settings, and hospital systems too, acute care and skilled nursing facilities and long-term care facilities.
Good deal. And I'm assuming that as you had your work experiences, one of the things that you noticed is that there are not a lot of minorities, especially African Americans, who are in the field of physical therapy and other allied health professional careers. So tell us a little bit about, why you're doing this podcast. You call it 5%, right? And so I know that means that only 5% of physical therapists are African American. Can you kind of elaborate on why this is concerning for you and other Blacks who may be involved in the field?
Yeah. All right. So, like you said, only 5% of physical therapists are African American or Black, and that's out of 250,000 therapists nationwide. Um, so, my thought in creating this podcast was to give voice to those therapists in order to tell our stories and hopefully just have a casual conversation on what their experiences was like, in hopes of inspiring someone else who may be looking into the field, and then inspiring other therapists who are in the field, if they're kind of reaching a point where they feel like they're burnt out, to kind of remotivate them, get them going again.
Good deal. So can you kind of elaborate on what type of mentorship programs are out there for anybody who is interested in the field? I know you yourself, you mentor young men in the Houston area, have done some mentoring. Can you explain any resources for anybody? I know we say young people, but even older people who may want to go back to school and become physical therapists. What programs are out there to assist them?
So from my experience, I've noticed that in different companies, you might go into senior level therapists or program directors may offer mentorship to those new therapists coming in. But I think you got to be very particular and thoughtful in that, in terms of you speaking up for what type of mentorship works for you. So they may think what's worked for another therapist that's come through work the same way for you. But if you know that style or technique isn't going to be helpful for you and your growth, you might want to have an open and honest conversation with them about that. But on social media, there are groups on different platforms that are for minority therapists. That does provide some good networking and mentorship. So you got to be proactive in going out, searching for those groups in order to get involved.
Good deal. So I know that you discussed, those mentorship programs, giving those, your listeners an opportunity to kind of figure out where they can get resources. But one of the things I kind of think about when you say that is, if there's a low representation of African Americans in the actual field, then we would probably surmise that there may be a low percentage of those who actually teach as well. So what advice would you give to young Black men and women who want to go into the field and go to PT school and may face racism, stereotypes, or even something as simple as microaggressions, not only as students, but as professionals once they graduate?
All right. So in thinking back on my program, I think it was one faculty member that was African American. But I guess the best part about my cohort coming in was probably, I think we were the largest incoming minority in the class. So that helped in order for us to lean on each other and have a good support system. But I think a lot of students kind of fail or not succeed as much when they come into graduate programs and trying to change how they study or what works for them. So know what works for you in terms of how you best retain information, how you best learn, and don't try to switch that up too much once you get into these programs, but you may have to ramp it up a little bit, but don't change what works for you. But definitely make sure you have a strong support system, whether it be one-on-one with that faculty member that may be a minority, or if it is with your fellow students, meeting with them regularly, even if it is just to discuss or get some things off your chest. But in terms of what you said in regards to microaggression, I think the biggest way that I've noticed it in my program or my educational history is like when you ask a question in order to get clarification from an instructor, and they will give you a short, succinct answer to the question, versus if you hear another student of a different race ask the same question and they give them all this detail or other information or how to apply it differently, but they didn't give you that type of feedback when you ask. So you got to kind of ear hustle as you're going through your programs to befriend those other students of different races, because they may have a little bit more insight on something that you might not know, because like I said, the instructor isn't giving you as much feedback when you ask questions. But look out for yourself too. Get with those friends that you've become really cool with, and then making sure you do kind of do your own additional research on the side to dive deeper into these topics so you have more insight for yourself.
We do. So you and others like you, let's say those who you'll probably end up interviewing over the course of your podcast, as you guys champion young Black men and women to enter the field, and you see progression, you see the numbers go up, of those African Americans who are choosing physical therapy as a career. How do you think that will change the field, as well as, what will that do as far as representation for those who are physical therapists, if you were able to increase the number?
So in terms of numbers going up, I think I do see somewhat of a trend in increased number of minorities get into the field of physical therapy and other allied health careers. I actually did participate in a mentoring program at a college in North Texas for students interested, specifically minority students interested in becoming physical therapists. We actually interview them, go up there, talk to them about my experiences in becoming a physical therapist. And actually a few of them were interviewed and selected to come down and actually shadow myself and other therapists on our day-to-day experiences in our professions. Exposure. So I think it has to start at home, so to speak. I think a lot of times in our communities, we tend to push students towards becoming athletes, becoming doctors and lawyers as being the way out. So we got to look more into other career paths. That's gives you a good foundation in the way out as well. Becoming pharmacists, becoming therapists, occupational speech, wherever it may be, because those are very rewarding careers too. You have a greater longevity in those careers, not as much burnout. You still are fulfilled and able to, quote unquote, get out as well.
You do. So I kind of see, based on your explanation, that this podcast will really be an effort to bridge the gap, so to speak, right? And so what types of conversations and topics are you planning for the podcast, and how do you think it will change the minds of young African Americans to enter the field?
So I have quite a few professional colleagues lined up, some who are in private practice, ownership, where they own their own clinics. Also those who have had administrative positions, those who work in continuing education sectors, and then those who are striking out on their own, doing very unique things in terms of their career paths. So it's my hope to kind of open people's eyes to what it is to be a therapist, how you can succeed in that, and then show that it is a very viable option versus some other things that may not be as realistic for some of us.
Yeah. So how long have you been a physical therapist?
So I graduated with my doctorate in physical therapy in 2009.
2009. So you're talking about 11 years.
Yes, sir.
So 11 years in, I'm quite sure that at some point you're going to want to kind of transition, even if it's within the field. So tell us about your future goals. Tell us where you see yourself in the next 10 to 15 years. Do you plan to teach? What's your options?
All right. So probably about, this is 2021. So probably about 5-6 years ago, I did start my own practice. It's Valor Performance Therapy Incorporated. But for my practice, I do more cash-based work. So I don't take insurances. So my patients pay out of pocket for my services. So that's another topic for another podcast on why people choose to go that route. But it makes it a lot easier, though. You don't have to deal with the nuances of what insurances will allow and not allow. But I also do some consulting work on the side where I get with other therapists. We discuss some things as far as startup and how to grow their businesses. But I do see myself eventually going into education. Can't say if that'll be full-time or not, because I do like working in the field, actually being hands-on with the patient. But yeah, at some point, I would like to be in the classroom, whether it's teaching DPT students or physical therapy assistant students.
So do you want to give your listeners a quick preview of what episode 2 will be about?
We don't tease them with that just yet.
All right, good deal. All right, well, I'll turn it back over to you, Dr. Harris. Speak to your listeners.
All right. Thank you guys for tuning in. This is just a brief introduction of myself, your host of the 5% PT podcast. Like I said, giving voice to those minority therapists in allied health professions. So I hope you tune in. Thank you.